Who you represent?
Good morning, Chairman Harshman and committee. My name is Jacques Beveridge. I am a doctor and OBGYN practicing here in Cheyenne. I'm a Wyoming native, born just down the street, practiced my entire career here. I have delivered thousands of babies in Wyoming who much and just like me carry a Wyoming birth certificate, and I'm super proud of that. I'm actually here, though, to speak in opposition to Senate File 109, despite my own personal beliefs, but in its current language, there's a problem. I'm here to talk about the one medication, misoprostol, or the brand name Cytotec. And I specifically want to address the medicine around that. So to clarify, and we've heard some folks talk about chemical abortions, but when chemical abortions are done, a physician that chooses to prescribe the first medicine, and unfortunately, all these medicines sound the same and look kind of the same on paper. So the mifepristone is given, and it's been described as killing the pregnancy, which it does. It blocks the progesterone support of that pregnancy, essentially killing the pregnancy. Then a medicine, the misoprostol, or Cytotec, the brand name, is given to soften the cervix, open the cervix, and cause contraction of the uterus to then expel the pregnancy. I've never in my career prescribed the first medication. I don't do that. The second medicine, though, I use all the time for many other things, and that's what I want to talk about. The inclusion of misoprostol in this bill is a problem because it's going to become unavailable. And although this bill specifically only names abortion as the crime that will be punished, misoprostol is included in the bill and is going to become unavailable as pharmacies across the state then don't supply it any longer. Pharmacists, pharmacies, hospitals, their administration, et cetera, are not going to want to provide this medicine for fear of being accused or prosecuting or defending cases for a medicine they distributed, but then they have no say or no control over how that medicine is used once it leaves their pharmacy. So what do we use this medicine for? How else do I use it? We use it for the treatment of normal miscarriages. That is clarified in the bill. But a number of other ways. We use it for postpartum hemorrhage. So a woman has a baby, she's bleeding, we can't get it stopped. This is a medicine we use all the time to save this woman's life or save her uterus or save her from going to surgery. We use it to ripen the cervix, to get the cervix to soften, to induce their labor when a cervix is closed and not ready for labor. I told you it softens and opens the cervix. That's why we use it at the end of pregnancy. And just last week on call, I induced 2 patients, had severe range blood pressures. Their cervix was closed. This was the medicine I had at my disposal. They got it all night, overnight, multiple doses, and delivered the next day. But if my pharmacy now says, I'm not going to provide this to you, we now have a problem. If this bill becomes law, causing the unavailability of misoprostol or Cytotec, without a doubt, it's going to lead to unnecessary blood transfusions, surgeries, anesthesia, unnecessary procedures, potentially hysterectomies, D&Cs, and cesarean sections, because we can no longer induce labor the way we want and to ripen the cervix. I have 4 alternative language ideas or amendments that I might throw out there for your consideration today. Number 1 is a simple do not pass for the reasons I've mentioned, and the way the language is written in this bill, that's the number 1. Number 2, you can remove misoprostol from this list of 4, and as one other person that testified said, really the other 3 medicines, they're all the same medicine. But the problem also then is if you remove misoprostol from the list, one of the amendments that has been made includes then a general description of other medicines that are similar. Again, we're leaving the door wide open. So that probably would also require and amendments. So number 2 is removing misoprostol or changing the language around it. Number 3 is a proposal to remove the punishments for the other people, pharmacies, pharmacists, manufacturers, distributors. The way the language is written, the transfer or use, to me, that almost opens it up to the UPS driver who carries it from the manufacturer to the hospital or to the pharmacy. If you know, so number 3, removing those individuals from who can be prosecuted. Number 4 would be the option to include in the orders for the use of misoprostol, in the order or the prescription, a diagnosis code. You wouldn't have to write out the diagnosis, but you could use a diagnosis code, which would allow its use and distribution by pharmacies or pharmacists and indicate those diagnosis codes where it's used and allow for that. This medicine is used every day in our practice of OBGYN throughout the state and throughout hospitals in ways that benefit women's health, in ways that preserve their fertility, preserve their blood from bleeding and postpartum hemorrhage, preventing C-sections, and potentially even preserving their life. It's an important medicine, and the way it's included in this bill is an issue, and it's going to become unavailable is what I'm concerned about. So thank you, Mr. Chairman and committee, and I'd be open to any questions that you may have for me.
Okay, thank you, Doctor. How many babies you think, how many years you been in practice?
So I've been in Wyoming for almost 25 years. I delivered about 1,000 babies in Lander, and now about probably 1,500 here in Cheyenne, I would say. And then another 500 to 1,000 before that in my training.
Wow. Okay, thank you. Okay, we have a question. Representative Oakley.
Thank you, Mr. Chairman. Thank you, Doctor. So I'm trying to work on an amendment that I think would work for your concerns. So I know you probably don't have the bill in front of you, but there's this, so I'll just read it. There's a section that says, or maybe you do. So on page 2, line 8, it says the prohibition in subsection A shall not apply to. So then then we added the use of the drugs listed for any other medical purpose. So the prohibition wouldn't apply to using these drugs for any other medical purpose. Do you think that would hit your concerns?
Doctor.
Mr. Chairman, Representative Oakley, I think that what you're saying, it would state that it would only be, that it would be allowed for any other medical purpose. Yeah, I think so, but the problem again lies in your prosecution of people who have no control over that medicine. So let's say I have a patient with a miscarriage we had just last week in the office. They elected to not have surgery and pass that miscarriage at home. They took Cytotec in order to do that, misoprostol. I write the prescription. One of my partners does to the pharmacy. The pharmacy has no idea why that medicine's going out the door. So they're still going to be hesitant to supply and stock the medication on their shelves for fear of prosecution of themselves, their pharmacy tech, et cetera. That's my concern about the way you've worded that.
It really is just to remove it or put the diagnosis code.
Mr. Chairman, so just remove it. The problem is, as you've heard, people are very passionate about this medicine for the reasons it's used for abortion. That was attempted on the Senate floor. Dr. Case made an amendment that Senator Case made that amendment, and that failed on the floor, so it stays in its current status to remove misoprostol from those listed drugs. But the other issue we have now is the way that it's been changed to also say substantially similar or generic or non-generic drug. I don't know who defines that. We would need some legal interpretation from maybe some of those in the room. Thank you.
Okay, any other questions, Doctor? Representative Bear has a question.
Thank you, Mr. Chairman. Dr. Beveridge, the fourth option you gave was having a code on the prescription. don't doctors already have to document any purpose that they're prescribing a drug?
Doctor?
Yeah, Mr. Chairman, Representative Bear. So we have to document it in our notes and in the medical record that stays within our office or hospital chart. But oftentimes the pharmacies may not have access to that, especially outpatient pharmacies. Now, if you're in a hospital setting, let's say, they probably can look in the patient's chart, but it's very different when it's an outpatient setting.
Follow up?
Thank you, Mr. Chairman. One of the concerns is mail order drugs. And it was testified earlier of a lot of side effects that, are issues as well as the necessary procedures to determine which drugs are appropriate for the situation. Do you agree with that earlier testimony? And do you have concerns with the prescriptions being filled by a mail order entity?
Thank you, Chairman Harshman, Representative Bear. Without a doubt, there is the ability to get mail order prescriptions. I mean, if they're following existing laws and rules, I don't know how you get around that. And you see advertisements on TV for all sorts of stuff you can get via mail order. I think if the law required a specific diagnosis code or something, it may be able to work into that. That I also don't know on those mail order prescriptions how the law would bear on prosecuting suppliers of these medicines out of state. That's a sidelight issue. If I answered your question, great. If not, let me know. Thank you. Thank you very much.
Good morning, Chairman Harshman, committee members. My name's Tara Muir. I'm the Public Policy Director with the Wyoming Coalition.
All right. Hi, everyone. Good morning, Mr. Chairman and representatives. My name is Dr. Melissa Dozier. I am a recent WWAMI graduate in OBGYN and have returned to Cheyenne and I joined Dr. Hinkle and Dr. Beveridge at Cheyenne Women's Clinic. I am here to urge you to amend the bill as similarly to Dr. Beveridge mentioned. I use Cytotec commonly in my practice for a variety of reasons, including induction of labor, postpartum hemorrhage, medical management of miscarriage. And in addition, I use it commonly for cervical ripening for gynecologic procedures, including endometrial biopsies, IUD insertions, and diagnostic hysteroscopy. In my short time since being back in Wyoming, I, as well as my colleagues and patients, have already begun to experience challenges in prescribing and obtaining Cytotec or misoprostol. Including Cytotec in this bill will exacerbate this ongoing issue by limiting availability and creating more paranoia and mistrust among providers and pharmacists. This will ultimately create delays in care and limit options and ostracize patients. By extension, unlike Dr. Beveridge, I commonly use mifepristone for management of medical miscarriage. ACOG actually has recently come out with data that supports the use of the combination of drugs, mifepristone, in combination with Cytotec to help pass pregnancies that have failed. And so in my training at Creighton University, which is a Catholic institution, they did not support abortion, but with the ongoing data, it was common to use both drugs in combination. Since coming here to Wyoming, I have not been able to see mifepristone used at all. And I think by extension with the Cytotec, this bill will just further delay the ability to prescribe and use that drug for these women, not for therapeutic abortion. Okay. And so for those reasons, I would encourage you to consider Dr. Beveridge's options in rephrasing these terms in that law. Thank you.
Thank you. Any questions? Okay, appreciate you being here today and your testimony. Okay, thank you. Go ahead. Good morning.
Good morning, Chairman, representatives. My name is Dr. Renee Hinkle. I am an OBGYN physician here in Cheyenne as well. I have been here for 24 years and delivered over 2,500 babies as well. I have never prescribed mifepristone. I do not do abortions. I am very much pro-choice. I am very much believe that women should have abortion as a reproductive health care right. I am standing here, however, not to try to convince any of you of that, because that's not the most important thing, I think, in this bill. For this bill, we have to get misoprostol out of the bill. There have been many examples in the last several months in different states that have outlawed abortion completely, or that have outlawed these medications to show that people who need this medication for the other purposes that the other physicians discussed have a difficult time getting those medications, even if it's not being used for abortion. And especially in some of our smaller communities in Wyoming, it will be very difficult to get this medication from a pharmacy who is not willing to take a risk of possibly being prosecuted if that medication is not used for what they think it's being used for. It will also be very difficult for hospitals to keep that medication or distribute that medication for emergency services, as Dr. Beveridge representative with postpartum hemorrhage. And so this medication, again, is used every single day in this state for women to help them, not for abortion. And so getting misoprostol out of this bill is, I feel, the most important part of that. Misoprostol is not used alone for abortion. It is used in conjunction with the mifepristone. And so it is not, if you take this out of there, it will not be used as a primary abortion drug. It's just not used that way. So getting misoprostol out of this bill is very important. Diagnosis codes will only, putting diagnosis codes on the need for this medication will only delay ability to get the medication, and again, will not help with hospital pharmacies. These medications are very important and they are very safe. American College of OBGYN believes that these medications are safer than doing surgical procedures.
Okay, so trying to do this 20 minutes on each side. So I pushed the stop on the timer. I didn't want to go off in the middle of your testimony, but any questions of the doctor? Good doctor. So I think we got the message on the, say the word misoprostol.
Misoprostol, yes, sir.
Yeah, and I heard a different drug from the previous doctor. Is that a generic?
Okay, so misoprostol and Cytotec are the same.
Same thing, okay.
Yes,
so-
Cytotec is the brand name. And misoprostol is the generic name. Mr. Chairman, it's similar for the other medications,
Got it. So
mifepristone and the other ones that are listed are generic.
I just want to make sure if there's amendments that we know what we're. Okay, very good. Appreciate your testimony. So I'd like to wrap this up, and I've done this. I'll just give you each 1 minute each. Okay, so go ahead. Why don't you go first, and then we'll wrap up public testimony. Thank you so much.
Thank you, Mr. Chairman. I'm Rebecca Smith. I'm the director of the Wyoming Women's Foundation. We oppose this bill for the reasons that the